Hello everyone. A warm welcome to Mr. Nitin Sanghvi. He is our patient who we had treated with venous seal, and Nitin ji has very kindly agreed to share his experience with us. And let us hear from Nitin ji about his experience. Good afternoon, sir.
Good afternoon, doctor. Thank you very much.
So, how are you feeling, Nitin ji?
Well, I do feel I feel much better than what I had been feeling in August, September after the surgeries you done in September. And I feel, well, when I see varicose veins.
Varicose veins, no? So, can you run us through your, your symptoms so that our patients understand what you felt before? So, how did it start? When did you realize you had varicose veins, and what was the sequence of events?
Well, right from about June, maybe I should say about 3 to 4 months before the surgery, I used to find my leg not being very stable, especially the left leg, and I used to be little get off balance at times, and I used to feel a little bit of itchiness on my leg, or on the lower part below the knee. Those things were there. But apparently, what happened is in mid-August, I had dengue, and the next day, in the evening, I had my left leg was totally swollen so badly and full, and it was absolutely red. The next day, I got admitted into after my swelling of the leg and everything. The next day, I got admitted into Patel hospital, where my admission was not because of the leg, but my admission was because of the dengue.
Okay.
And they treated me for my dengue first on IP and everything. And when the doctor who was treating me for my dengue saw the leg, and he said that I need to call somebody else from the doctor who is looking after, who does all this in Patel hospital. That person came in and he told me, he said, he diagnosed that this is cellulitis, and he gave me medicines, antibiotics and everything, but the swelling was not getting down as much as it wanted. So then he told me that, see, now your dengue is cured, your reports are clear, but for the leg part of it, you need to show to some specialist who would be able to guide you and who could treat you on that. So coming to that, then for the leg, apparently I consulted my family doctor also, and she said that this could be a vein problem. So we were discussing amongst ourselves in the family who would know whom to consult and what to do. And apparently then my brother-in-law came up with your name, and he said that no, he's a very good doctor and he's specializing in varicose veins. So you see, get to see him. And I believe you're award winning for two of the cases also.
So Nitin ji, when you came to us, most varicose vein doctors don't do their own scans.
Right.
You see. So can you tell our patients a little bit about about the consultation when you came first time, and when we did our own scans, how much did that help you understand the problem?
Well, that was really good in the sense that when you did the scan, then you showed that the veins have been flown. I mean,
increased in size.
And when you explained to me and my wife also that the blood flows down, but the blood doesn't flow back because the veins are blown up, and that is, and especially the left leg. Then you also diagnosed, and you said that the right leg also has started. And then you said that after you did the scanning, you were of the opinion that surgery would be the best solution. And I think we did the surgery at the earliest.
Yes. So again, how was your procedure experience? So usually when a patient is told about surgery or undergoing a surgery is a little bit of a I mean, if even if I have to undergo, say, even a dental surgery, I am a little scared. Like, kaise hoga? Is it going to hurt when I do it? So when the actual procedure was done, uh, how were your feelings before the procedure actually, like one day before? If tomorrow is my surgery, then obviously there must be some apprehension with you. And when we were doing it, was it, were the apprehensions matching? Or, if you thought about it before, one day before the surgery, how were you feeling?
Well, see, it was a surgery is a surgery where to every human being,
Yeah.
it does affect you a little mentally, physically. I mean, you feel what is going to happen, what is not going to happen, whether surgery is going to be successful or not successful, and especially being legs. Like legs is one of the main parts of the body. If your legs are stumped,
Yeah.
you are then you are not able to move. You are not able to do anything, your normal activities. So that apprehension is always there. And now, when you mentioned to me about the Venesil, I really didn't know what was Venesil. So I said, I don't know. I mean, let's see, let's do it. But see, since you said this is just the beginning, and if we do delay it, maybe it will get worse.
Yeah.
So the opinion of everybody was, let's have the surgery done at the earliest. So if things can improve faster, probably I would be able to move and back to be my normal self at the earliest.
Yes. So, Nitinji, when we were actually doing the surgery, was it, if you would, was the discomfort as much as you might have imagined before, or was it less than what you thought it
No,
should
no. The discomfort was very much less than what I thought or what I imagined, because I think I don't know, you know better, but the anesthesia was given to me on the lower part from the hip onwards, I think.
So actually, you were given some mild sedation. There was no spinal anesthesia or anything.
Right.
So we usually give a local anesthesia cream on the leg so that numbs the skin a little bit. But there was no needle in the back or anything like that. You were given some sleeping medicine, and more sedation was actually from the Mohammed Rafi songs.
Yeah, that was actually good.
Yeah.
Because then that you are more attracted to the song than the surgeries at times.
Yes. So Nitinji, after the surgery, so then you came back for a follow-up at 7 days and then 2 months. So now if you compare now, like before we started talking, I showed you pictures of how it was before. And if you would, so how much different do you feel, and how much, improvement do you think is there from what we started?
Oh, there is a lot of improvement. Because earlier I used to get that itchy, I used to feel that heaviness, I used to feel that, as I told you earlier, the little bit of imbalance, which I don't get so much now, hardly anything. Of course, the lower part of the leg, just above the ankle, is slight. It is yet blackish, but that, as you mentioned to me on my last visit, that as time goes, it will go back to
getting better with time. But I think it is it's much improved since the first picture.
Yes, definitely.
So great, Nitinji, and and you are in the travel industry, right?
Yes.
You work in a travel industry. So does so as we know that sitting or standing for a long period of time continuously is one of the risk factors for this varicose veins. So do you think were you in your work profile, did it involve maybe sitting at a desk for a long time?
Yes, it is.
And this was like for many years together.
Yes, it has been for many.
So like a sedentary lifestyle or sitting for a long time sort of prevents the blood to flow back properly, and many decades of this can cause this problem. And thank you, Nitinji, for sharing your experience with us. And I'm sure our patients would be would be much benefited by knowing and understanding the condition, like from your experience. And is there any message that you can give our patients who who are listening to you right now and maybe thinking, should I do this, should I not do it? And if somebody of your age who's thinking about getting their varicose vein treated, what would you say?
Well, I would say that Dr. Saurabh and his team, they are always very, I think, efficient and helpful and whatever. and they do not leave any stones unturned. And especially I had assistant doctor who was Miss Dr. Sonali Ahuja, was looking after me, and she, I think, was very nice. I cannot. So I don't say that Dr. Saurabh is not nice or Dr. Patel, who the two persons at the Sajeev are not. But I mean, it, you know, it is like giving you that insight, giving you that backing, which makes you feel more confident, which makes you, you know, less apprehensive about what is going to happen or what, you feel that things will normalize.
Yes,
that is what is important.
Great, and great going, Dr. Sonali, and I mean, kudos to you. Great, and thank you for appreciating your team, sir. And I hope you continue in your recovery and you get much better real quick. Thank you so much for it.
You are there for that. Not me. I cannot do any recovery, but I'm sure you will look into it and you will get me recovered at the earliest.
Thank you. Thank you. It was a pleasure talking to you.
Thank you, doctor. Thank you.
Thank you.
And to your team also, please.
Thank you.